My name is Amir Moradi. I'm a facial plastic and reconstructive surgeon and have been practicing in San Diego County for the last 26 years. What that means is that you go through surgical training to perform a certain specialty, in this case, facial plastic and reconstructive surgery, and you have accumulated the cases necessary to be an expert in that field. Then there's an outside independent agency or body and a board that looks at your qualifications and the cases you provided, your past history, and also you have to show that you have passed and continue to pass certain recertification examinations to make sure you're keeping up with your skills, and periodically, every few years, that you have to show the number of cases that you have performed to make sure you continue to be abreast and at the forefront of your specialty. As you know, this is your face. This is something that we have to be extremely careful with. So choosing the right surgeon is of significant importance. And this is one of the areas, unfortunately, that I see that there are individuals that start to look for alternatives for other reasons to go with someone versus the other, and they end up regretting that choice. And correcting those things, I've found those to be extremely difficult to correct certain aspects of a facelift that did not go so well. My double board certification, number one, is in otolaryngology or ENT, which specializes in the surgical procedures of the face and neck. And my specific specialty is facial plastic and reconstructive surgery. That's my second board certification, and that's what I've been practicing for the last 26 years. What they need to do is look at their surgeon specialties, board certification, education. Those are very important. The years of experience, their reputation with other patients, and whether they are active as far as teaching is concerned or further education is important also. In my case, I've been practicing facial plastic surgery for the last 26 years. I have been fortunate and privileged to give lectures on multiple different meetings, and I have been a volunteer clinical instructor at UCSD Anatomy for the last 20 plus years, which has provided me with this continuous exposure to facial anatomy, and also being involved in clinical trials and also anatomical publications. I would love to hear from you. If you have any questions or concerns, call our office, talk to my teammates, and can answer your questions, or you can ask for me, come in for a consultation.